So today we're going to be talking about hallucinogens. This is by the Elizabeth Squared. Introduction and history. So hallucinogens such as psychedelic plants and fungi have existed for more than 250 million years, and their use by humans go back more than 10,000 years. More than 4,000 plants have a psychedelic or psychoactive properties, but only a few hundred have a history of use down through the ages. All-arounders consist of LSD, psilocybin mushrooms, peyote, ecstasy, and marijuana. They can act like stimulants or depressants, but most psychedelics dramatically alter the user's perception of surroundings and thoughts and create a world in which reason takes a back seat, and the intensified sensations generated by illusions, delusions, and hallucinations. The general effect. Even though many psychedelics have been used for thousands of years, formal research has been minimal because most psychedelics are grown illegally, found in the wild, or manufactured by street chemists or foreign interests. For this reason, much of the information on the effects of psychedelics is anecdotal rather than the result of extended research or scientific testing. In addition, most plant-based psychedelics contain more than one active ingredient, making it difficult to determine which chemical is causing which effect.
Indole psychedelics like LSD, psilocybin mushrooms, particularly affect serotonin receptors, especially 5-HT2A, which is in charge of regulating mood, perception, sleep, and anxiety. Serotonin boosts mood, also sleep, anxiety, and areas of the brain involved in hallucinations. LSD was initially studied as a treatment for mental illness, but was made illegal in 1966 and classified as a Schedule I drug by 1970. Though research halted in the mental health field for LSD in the 1970s, LSD and psilocybin, as well as some other things, are being kind of brought back into the scientific lens of understanding what their therapeutic potential might be. And some of the physical and mental effects of hallucinogens, kind of what they do is stimulate the sympathetic nervous system, which does stuff like raise pulse, blood pressure, and breathing, with possible side effects for sweating and nausea. These substances also affect neurotransmitters like serotonin, dopamine, and glutamate. They can overload sensory pathways in the brain, especially in reticular formation, leading to heightened awareness, and synesthesia, so meaning where senses blend, where you can kind of see sounds or hear colors.
So mental illnesses and LSD. Proponents of psychotherapeutic use claim that drugs stimulated insights avoid some users a shortcut to the extended process of psychotherapy, which involves uncovering traumas and conflicts from the subconscious to help the patient heal. However, users of pre-existing mental illness or inability can aggravate those conditions with LSD, causing more severe mental disturbances. Some otherwise normal users can be thrown into a temporary but prolonged psychotic reaction of severe depression that requires extended treatment. Some users experience mental flashbacks or sensations of a trip that they had while under the influence of LSD or other psychedelic drugs months or years later. This is called HPPD. Magic mushrooms. The other major groups of indole psychedelics is psychedelic mushrooms, whose active ingredients are psilocybin and psilocyan. Their sacramental use dates back 6,000 or 7,000 years, but serious use in mushroom cults go back about 3,000 years. The chemical structure of psilocybin is similar to that of LSD. Psilocybin and psilocyan found in more than 100 different species of mushrooms from various genera. The psychedelic effects include visceral sensation, changes in sight, hearing, taste, and touch, and altered states of consciousness. Recent research uncovered a great similarity between psilocybin-induced spiritual experience and drug-free sudden mystical experiences. Peyote and MDMA psychedelics. Although this class of psychedelics is chemically related to adrenaline and amphetamine, many of the effects are quite different. Many substances in this class take hours to reach their peak. This class of psychedelics includes natural resources such as peyote, cactus, and another number of synthetic compounds such as MDMA. The effects of peyote last approximately 12 hours and are very similar to those from LSD, with an emphasis on colorful visions and hallucinations. Some people react to psychedelics depending on their mindset in the setting, as well as the actual properties of the drug for the use of mind-altering substances in structured ceremonial settings. Can you do some more spiritual feelings than at a rock concert? MDMA. In the early 2000s, ecstasy was a psychoactive drug with the highest public profile. Since 2003, the use between high school seniors and young adults of ecstasy has declined to about half the peak level that it was in the early 2000s. The bigger and the more current interest is for Molly, a refined, often crystalline form of MDMA sold in capsules, which users say tend to be stronger than the old ecstasy pills. The psychostimulant MDMA, usually sold as a capsule, tablet, or powder, can be swallowed, snorted, or injected. The physical effects are similar to those in ketamine, such as increased heart rate and respiration, excess energy, fainting, sweating, hyperthermal, increased body temperature, chills, and hyperactivity. The mental and emotional effects last 60 minutes after indigestion and continue to about 3 or 4 hours after indigestion. MDMA induces feelings of happiness, clarity, peace, pleasure, and altered sensory perceptions without having any depersonalization or detachment of the users from the realities of their environment. Users report experiencing an increased non-sexual empathy for others, more self-awareness, and high self-esteem, open-mindedness, acceptance, and intimacy. Today, research and then the next one is marijuana. This is our last one for substances. And today, researchers have discovered more than 420 chemicals in a single cannabis plant. That's how they get the number for 420, is the amount of chemicals. Just fun fact. When the smoker ingested these potent psychoactive chemicals are converted by the liver into more than 60 other metabolites, some of which are psychoactive. The physical effects of marijuana often include relaxation or sedation, some pain control, bloodshot eyes, coughing from lung irritation, increased appetite, and a small to moderate loss in muscular coordination. Some mental effects take place within a few minutes of smoking marijuana, and the user might feel slightly confused, have mental separation from their environment, producing a feeling of deja vu. Additional effects include drowsiness and aloof feeling, and difficulty concentrating. Strong varieties of marijuana can cause increased alertness, major distortions of time, color, and sound. And here's our case study. Elizabeth, take it away.
Okay, yeah, so this is our case study. Our client is named Jessica. She's 23, female, Caucasian, currently dropped out of university and is working as a part-time barista. A little bit about her presenting problem. Jessica is coming in and seeking treatment after a kind of scary experience with psilocybin mushrooms that resulted in a 48-hour hospitalization for drug-induced psychosis. She acknowledges that her psychedelic drug use has escalated over the past year and has negatively impacted multiple areas of her life, including college, strained family relationships, financial instability, and deteriorating mental health. Jessica expressed that she's scared of what's happening. She's scared of what's happening and feels as if she's stuck in a cycle. While committed to addressing her marijuana dependence, she remains somewhat ambivalent about completely ceasing all psychedelic use, believing some substances like LSD have expanded her consciousness, providing therapeutic insights. Jessica began using regularly at age 17 during her senior year of high school, marijuana specifically, which escalated to heavy use by the age of 19 during her sophomore year of college. She currently uses multiple times a day, consuming 1 to 2 grams throughout the day through vaping and edibles. She claims to have experienced withdrawal symptoms when attempting to reduce or stop using marijuana. At age 20, she was introduced to LSD by some friends, which she claims to be life-changing, and began using it frequently, monthly. Approximately 8 months ago, she began experimenting with psilocybin mushrooms, initially using every few weeks, but continuing to increase that dose as time has gone on. Her most recent mushroom experience resulted in severe paranoia, hallucinations, and disoriented thinking that prompted her roommates to call emergency services. She's made 3 previous attempts to reduce her marijuana use, but the longest period of abstinence has been about 3 weeks. And she hasn't previously sought any formal treatment for substance use before. And a couple of the varying factors about this client in particular, biologically, she presents with indicators of substance dependence and related health consequences. Her cannabis use has altered her daily functioning, as evidenced by withdrawal symptoms during her abstinence attempts. Her recent hospitalization for drug-induced psychosis following psilocybin use indicates neurobiological vulnerability to hallucinogen effects. Physical manifestations include disrupted sleep patterns, averaging about 4 to 5 hours nightly, including also weight loss, developing migraines and cardiovascular symptoms. These symptoms combined with family history of substance use, specifically paternal alcoholism, suggest both acquired and possibly genetic neurobiological vulnerabilities that place her at higher risk for continued substance use related complications without further intervention. For her psychological factors, Jessica exhibits significant psychological impacts from her substance use patterns, including cognitive, emotional, and behavioral consequences. Cognitively, she reports short-term memory issues, concentration difficulties, and perceptual disturbances, specifically in the form of flashbacks that persist between uses. Emotionally, she experiences increased generalized anxiety, periods of low mood, and occasional passive suicidal ideation, especially during bad trips and cannabis withdrawal. Her coping mechanisms rely heavily on substance abuse to manage her emotional distress and anxiety, as well as sleep difficulties. Despite experiencing a severe reaction during this recent hospitalization, she maintains ambivalent beliefs regarding the benefits and drawbacks of her current use behaviors. And for social factors, Jessica has a couple. She currently has a couple barriers to recovery regarding social aspects of her life. She has narrowed down her social network significantly to prioritize using and use relationships with others, specifically music festivals and parties. Outside of that, she doesn't really have too much of a social connection. This also has caused a lot of strain on her educational success and relationship with her parents. She currently also is experiencing financial instability with her job because she is dependent on her use behaviors to provide a main source of function. And her mother and father are both not necessarily supportive. They're supportive of recovery, but not so much of these behaviors. So the relationship has been a bit strained since then. We assessed her ASAM criteria or dimensions would be, the first one would being physical dependence on cannabis, which reported withdrawal symptoms during previous attempts to quit. no current acute withdrawal symptoms, but will require monitoring during abstinence. No history of severe withdrawal symptom complications. For Dimension 2, we have recent weight loss, developing migraines, and possible correlation to psychedelic use, as well as cardiovascular symptoms and disrupted sleep patterns. No urgent medical conditions, but does require current monitoring. For Dimension 3, we have recent hospitalization for drug-induced psychosis following psilocybin use, ongoing perceptual disturbances, cognitive impairments, memory problems, increased generalized anxiety, periods of low mood, occasional passive suicidal ideation during substance use and withdrawal. She also requires significant mental health support. For Dimension 4, she is self-referred to treatment following hospitalization, expressing fear about her recent episode, and recognizing there are negative impacts of her substance use in multiple life domains. However, she is maintaining a little bit of ambivalence regarding psychedelic abstinence despite these current events. For Dimension 5, we have multiple failed attempts to reduce cannabis use with longest abstinence period of only 3 weeks, escalating pattern of psychedelic use despite negative consequences, inadequate non-substance coping skills, significant cognitive distortions regarding the benefits of continued use, and high risk for relapse without structured intervention. And for Dimension 6, we have kind of as evidenced by the social network that she currently has. It's very centered around substance abuse, loss of non-using relationships, financial instability, dependence on family, strained relationships, and pending legal issues related to substance use possession, as well as abandonment of previous social activities and roles and environments that present substantial barriers to recovery. We assess that the diagnostic criteria that she fits into have kind of look like hallucinogen use disorder, cannabis use disorder, hallucinogen-induced psychotic disorder, and hallucinogen-induced anxiety disorder. And the Z codes for that are going to be Z6372, alcohol and drug abuse in family, and Z81 for family history of substance abuse. What we've assessed her level of care recommendations should be based off of what we know, is that she would benefit from an intensive outpatient program with consideration of PHP, partial hospitalization program. If she is unable to maintain abstinence from these psychedelics or having experiences of worsening perceptual disturbances, high ratings in Dimensions 3, 5, and 6 indicate a need for a structured treatment that provides intensive mental health support while monitoring reoccurrence of psychotic symptoms. Recent drug-induced psychosis and ongoing perceptual disturbances warrant close psychiatric monitoring, while her limited non-abuse, substance coping skills, and high-risk social environment necessitate intensive therapeutic intervention. Her moderate withdrawal risk from cannabis suggests a need for regular monitoring during initial stabilization, however, it doesn't appear that she needs 24-hour supervision at this time. If her experiences of worsening psychotic symptoms, increasing suicidal ideation continue, it's possible that residential services might be needed. Her treatment plan should give her access to higher levels of care if needed, given her history of substance-induced psychiatric conditions.
And
so, yeah.
That was it.
That was it.
Hopefully it recorded on the regular one so we don't have to use the video. Thank you guys for watching.